Okay, we are back with Dr. Carrie Leff, and my cheeks are already pink because Dr. Carrie Leff is an internist, and she sees my children. And she's, are you a pediatrician internist? I mean, what's the official?
We're both. So in our office, we're double board certified in internal medicine and pediatrics. We call it MedPeds.
MedPeds, okay. But I'm pink because today Carrie is going to be talking to us about puberty. And, you know, when I first heard Carrie talk about her passion to educate parents on this topic, I thought, Carrie, my kids are so young. I don't need to worry about this for years. I'm going to tune you out. And then I heard her say, no, you actually have to start young. So let's talk a little bit about first, what made you begin educating parents on this topic? Was there like an aha moment?
Okay, so first, I'd like to thank you for having me here, but I can tell you a little bit about my journey. Like you said, in private practice, I work as a part-time internist and pediatrician 3 days a week in Novi, Michigan. I also have 3 daughters. They're currently 11, 9, and 6 years old. So I've always been, for some reason, when I had my 3rd daughter, there was like this pressure on me I felt when it was the 3rd one, for whatever reason, that all eyes were always on me. Like, I just felt it all the time. I was always taking them to the bathroom. That was my job, like in a restaurant.
Well, you're totally outnumbered your husband is outnumbered in the home.
Yeah, I mean, I have a wonderful husband who's super involved, but I just felt like they were looking at me as their like role model. And I felt like a lot of weight and pressure about that to like be better. So I think that's where everything started with me for girls. And so was working in the office, and because I do internal medicine and pediatrics, like I tend to see a lot of adolescents in that age group. Like some pediatricians will refer to us as their kids are outgrowing their practice. So that's kind of how that came. And there was always like this awkward, you know, kind of interaction between parents and kids when we start talking about body changes and puberty. And there's obviously not enough time in a regular office visit, which is like 10, 15 minutes once a year, to explain everything that's going to happen to your body in puberty. There's over 70,000 physician moms, women in this group, and it's fascinating, and it's like changed so many of our lives, and it's something that we're all involved in. We can present cases. You have to get accepted to the group by presenting your credentials, so it's vetted in that way. And me and a colleague who I did my residency with, were on a thread about something about talking about puberty, and we just were like, oh my gosh, this was an aha moment. We should have a class where parents and kids can come together and learn at the same time about their bodies, so everybody knows what was said and everybody's on the same page. And how cool and make it fun.
And thus Turning Teen.
So we started a company called Turning Teen about 2 years ago, a little over 2 years ago now. And we do workshops for parents and children to learn about puberty. We started with girls ages 8 and up with our first program called Body Basics, which basically talks about the differences between boys and girls, what happens to your body in puberty, definitely some emotional stuff, introduction to periods. And then we moved on and started a program for the girls who are in puberty, like ages 10 and above, of how to take care of their body in depth, how to take care of periods, skincare, all that. And actually this weekend we're starting with boys.
Yay! Good for you.
Maria.
Don't say it.
I know. So, and then we actually have a parenting program as well called Surviving Puberty for the Second Time. So I guess that's how I'll bring it back around to parents.
That's awesome. And I do have to say, so I took my daughter to the first workshop, and you are currently doing local workshops, but eventually we'll be offering other types of workshops, correct?
Well, yeah, actually we have a pediatrician this is really exciting, who's joining us from New Jersey, actually, and she's going to start doing them locally in her area. And obviously we hope to expand. We're learning as we go for our business. So that's definitely something that we're looking forward to.
Very cool. And so I want to jump into the talk, but I will tell you, in the workshop I took with my daughter, the biggest thing I got out of it is how important it is to just be open about these things and to not be embarrassed, and to talk about what is the maxi pad sitting next to your makeup bag once a month. You have a stack of tampons or pads. Talk about what that is, because they're curious. And if
Yes.
you're a parent of young children, you know they're curious about those things. So why don't we jump in, and I want you to start sharing with us the talking to your children about their bodies and body parts at an early age and how we do that.
Okay, so I guess I just want to start by saying your kids are never too young to start learning about their body, but it's never too late either. Obviously, you've had a lot of experts on, and we don't want to discourage parents from starting like today. So it doesn't matter how old your kids are. But if you have young kids, the younger the better. And there's lots of different ways to get started. So when a kid is 18 months and comes into our office, we like to know, do they know where their belly button is? Do they know where their ears are? Okay, at that point, you can tell them in the bath, and name their different parts. That's the way to start. So we kind of divided up with how to talk to your kids at ages like 4, 8, and 12. So I thought I would walk you through it like that.
Excellent.
So basically, right, at age 4 is sort of the best time to really begin. And there's lots of different opportunities to talk about your body all the time. And in our programs, we talk a lot about how when a parent gets motivated to talk to their kid about something, they want to like sit down and have this like big conversation, right? Because they're like, I'm going to do this. But that's not really the most effective way to talk to kids. Probably the most effective way to talk to kids about any of these things that you've been talking about is like in little snippets. Like we always say like 31-minute conversations instead of one 30-minute conversation.
Oh, I like that.
Any like everyday opportunity that you can take out of your day that just presents itself to talk about your body or anything else is sort of more natural and doesn't make it so awkward or, like feel forced or whatever. So at age 4, make sure your kids know all their body part names, including their private parts. It has to do with body safety. I know that Maria gets a little bit embarrassed with me using the words penis and vagina, but I think that really feel strongly that we need to desensitize ourselves and be able to use these words just like we say arm or leg.
And we should not be saying wee-wee, woo-woo.
Right. So we decided that people make up nicknames for things when they're uncomfortable talking about them. So we have lots of nicknames for our private parts. People come in the office and tell us they're wee-wee or they're flower or they're something, we would rather in an appropriate place, it's okay to use the word penis and vagina. Those are actually the words for your parts.
Penis and vagina.
So in our program, I'm just going to go ahead and do it. We scream vagina 3 times like this. Vagina, vagina, vagina.
Vagina. It's healthy.
I'm still standing. Like everything's fine in my world. So yeah. So anyways, starting to name body parts, let them know that private parts are different than like public parts. We cover up our private parts. We don't show them to other people, and other people shouldn't really touch or see our private parts. So there's lots of different opportunities to talk about things like when your kid is 4, a lot of times you're having another baby or you may be pregnant or breastfeeding. Okay, those are really good everyday opportunities to talk about body parts. Like how amazing is our body? We can grow a baby in our body for 10 months and then we can feed it from our breast for an entire year. That's pretty cool. So those kind of things are really good ways to start off with your kids at that age. As they get older, so that's kind of 4. Mm-hmm. Oh, and I actually just have some books here that I just wanted to show.
Thank you.
So this is our favorite one of our favorite series by Robbie Harris. This is the one for the youngest kids. It's called It's Not the Stork, and this is appropriate for ages 4 and up. So that's another way to get started if you feel like you can't get the words and you need help. That's one book to look at. So 8 years old is actually we say 8 is great for the sex talk, Maria.
I did not know this.
Okay.
Continue on. I'm learning. I'm taking notes.
Okay, so 8 is great to tell your kids how babies are born. So babies grow in our body for 10 months. They grow in our uterus, and a baby comes out through your vagina. That's how a baby is born. I understand that some women might have C-sections, and so they feel like they have an out. I always would encourage mothers, even who have C-sections, to kind of make it clear that babies are supposed to come out of your vagina. They're really not. That's not like the normal way to have them cut out. Just because it helps in our understanding of how babies are made to understand how they come out, because they actually, Lisa and I were just talking, they come out the same way that they got in there. That's what we just, decided. So, periods, like you were talking about, the maxi pads sitting on the counter or tampons, that's a once a month opportunity to tell your girls, or boys, I suppose, that you have to take care of your body. This is the way my body gets ready to have a baby, but I'm not going to have a baby this month. So I actually have to bleed from my uterus through my vagina. That's what a period is. We start our programs at 8, so if you don't feel comfortable with that, you're more than welcome to come to Turning Teen. We'd love to see you at our programs. And it's really important at age 8 also just to remember, bring it back to body safety and body boundaries. We like to talk about an icky feeling. And this is really on my mind with this gymnastics thing lately, so I just wanted to bring that up. I know that some of these girls told their trusted adult and all this stuff, and I can't really make heads or tails of that, but I like this idea of this icky feeling, which is if you get this feeling in your tummy that something's not right or somebody's not giving you like a good vibe, you should trust that, because that's called your intuition. And you should know that if you feel strange about something, you have a band of people that you can come and talk to. We call them your trusted adults. So we encourage parents to tell their kids to find like 3 trusted adults in their life. One of them should probably not be a relative. So it could be your mom, your dad, maybe one of them is a teacher or a close family friend or something like that they can tell, anything to, and it's like a safe space. So I think that's really important to talk about at that age. And then the sex talk. 8 is great for the sex talk. So here's the thing. I'm going to break the rule. I told you 31-minute conversations, little snippets every day. The sex talk actually, I think, is a little bit different. Like, it should be its own thing. It's kind of amazing. And the whole importance with all of this is that we set the tone, okay? So if you're going to go ahead and get started talking to your kids and you're like really embarrassed or your face starts turning red or you like start mumbling, it's going to give off the idea that you're like not really open or this isn't something that you're comfortable with. But you want to give your kids.
Are they going to come to you when they need you if you're behaving that way?
Yes, you want to give your kids the impression that your house and you are somebody that difficult conversations can happen with, and it's okay. And you might not all know the answer every time, but that's okay. We can figure it out together. So give off that like a good vibe about it, not like an embarrassing vibe. So anyways, when you think your kid is ready for the sex talk, after you've explained different things, it's important to set aside time to do that. So I think the best way to do it is just by pulling out one of these fantastic books that's already done it for you and just reading it together. And it's also kind of awkward to like sit, like we're sitting right now, if with your child face to face and like stare each other in the eyes and be like, so this is how it all happens, right? So we don't think you should do that. Actually, the best way to do it is probably lying in bed together. You're side by side. You're not looking each other in the face. You're just reading the words on the page. So this is the one I like the best for Robbie Harris. It's so amazing. And there's chapter 9 or something like that. You just go ahead, pull it out and read it. That's exactly what I did for my kids. And they wanted to come back to it like for 3 nights in a row.
Curiosity.
And that might be what happened. Yeah, curiosity. So they're really, really curious. So that's a set aside moment that you do that and then come back to it. Again, if they start asking questions, if you don't know the answer and you don't have it on the tip of your tongue because you don't do this like for a living, that's okay. You can say things like, first of all, stop and breathe. We say take a Snickers like moment and then say, I'm not exactly sure I want to answer that right now, but let's like talk about that tonight. And then let's read that in the book. Key point here is you have to go back and answer the question. Okay. Otherwise they'll get the vibe that you're not open. And then the other good, like kind of stall tactic for something like that is saying, so tell me why you're asking that question, or what do you know about that so far?
What do you know about that?
Yeah, stall tactics, kind of see where they're coming from. Because you might think they're asking you one question and they might be asking you something totally different. And so it's good to kind of know where their curiosity lies.
Remember, kids are kids, and sometimes things are so literal for them. Like my 4-year-old the other day was at the piano, touching the piano keys, and he said, so how do I get to see the key that opens the door inside of all these? And I was like, oh, gosh, you're right. You would think there's like a key that opens a door in the keys of the piano. Like, kids are literal. So sometimes they might not really know what you're talking about. So I love that.
This is totally new information. So when you read this like chapter about reproduction,
ask questions, dig deeper.
they like might giggle or laugh, but they also might be fascinated by the fact that this is how it works. Like there's no stork, there's no baby fairy. Like, what do you mean that's how it happens? It's fascinating when you think about it like that. And we kind of think that you should approach it from like a animal behavior perspective.
Okay.
Remember that kids who are like 8 years old have no context of sexuality. They really don't have hormones circulating. They don't have all these stigma and feelings attached to sex and all this stuff that we have. So that's all our construct. They don't have that. So they're just thinking about it like as if you went to the zoo, okay, and you see two animals getting together, they're making another baby. That's how we don't become extinct like the dinosaurs. We have to be able to create new people or we can't go on.
Now, Carrie, I have a really important question, I think, and I'm not sure if I've ever heard you cover this before. How do you address my concern and my worry is if I do talk to my children in the home, I guess I like the idea of you saying, talk to them at an earlier age, because I would love for it to come from me. So my worry is that it's coming from others at school. So do you say to your children, hey, this is an important topic, but all families have to talk about it within the walls of their own home? Like, do you kind of give them some type of a, don't tell your friends at school?
Yeah, I actually think that what you said was like a really good way to say it. I think that if you're talking to your kids about sex at 8 and you're naming your body parts at 4, you're definitely like kind of more progressive. And I don't think that everybody's doing that. So while I do think it's okay to use the words penis and vagina appropriately, like to name your body parts, like my vagina doesn't feel right now type of thing. I also don't think that you need to scream the word vagina in the lunchroom. Mm-hmm. So it is important to say like, this is something that we're talking about and it's private, okay, and I'm telling you, but all other parents might not have told their kids about this. So if you have any questions, I really want you to come to me, and their parents have to open up to them when they feel comfortable.
Okay.
Like a Santa Claus type of thing, you don't want to break that kind of secret or whatever. So, but I liked whatever you said. I thought that was really appropriate, but so we don't want to shame any of it though either. Like make it seem like this is something to be embarrassed about or ashamed of. That's something to be careful of as well. But just, it's like a private conversation that happens in your home.
Fantastic. And to wrap up our conversation today, I know a big part of all of this is gaining independence. So we want to educate our children because the goal of adolescence is that independence, correct?
Yeah, so we think that the goal of puberty is to reproduce and to create new people. And the goal of adolescence is independence. That's why adolescence is so hard. And also we think that one of the goals of adolescence is emotional control, which is really hard because you have to model emotional control for your kids. And that's where the whole tough part comes in. And so we do talk, I don't know about emotions in our programs, and I just brought my emoji sticks. This is how we use them in our 8-year-old program. And with the way that we suggest starting to talk about emotions, I don't know if you've addressed this with other speakers, is just by naming that emotion. Yeah. So we say, name that emoji or express your emoji.
A couple speakers have said the importance of it because it really leads to empathetic listening and behaviors, because you can now see what other people are feeling because you are emotionally intelligent. You know different types of emotions.
Exactly. So you need to be able to name your emotions and how you're feeling. The advancement, like step 2 of that, is what you're going to do with that emotion. But it starts with naming it, or it also starts with reading other people's body language. Or what do you think that person on TV is feeling? Or you're in a restaurant, what do you think that they're mad about right now? Making up little scenarios, because that's part of emotional intelligence and is really, really important.
Fantastic. This has been, I have been checking, you've got positive comments below. People are really excited about this. And Facebook is pretty amazing, but it's reaching a lot of people already. So I guess parents are curious about how to talk to their children about this. And coming from someone who does this every single day as, a pediatrician, I think it's really important. And I know you see children all the time, and you can see that 10 minutes is not enough. Please don't leave it to the pediatrician to be having these in-depth conversations with your children. And the flip side, I was an educator for over a decade. You can't expect the 4th and 5th grade class that lasts an hour to do it all.
But just I know that we're wrapping up, but more than that is that even if they could, I don't know that that's what you want, right? Because the only person that can teach your kids your family values is you.
Mm-hmm.
And the only opportunity that you have to do that is if you talk to them about it. So your school can't do that. Everybody feels differently about these topics. And so you really have to make sure that you're the resource, not the kid on the playground, certainly not the internet, and maybe not even the teacher. But because if you start talking about bodies at 4, sex at 8, you might have a chance to talk about, consent and dating and relationships and all these really important things that come up as they're a tween and a teen. If you never start, though, you're never going to get there.
And at that point, when you are talking consent, they are trusting you because you have given them so much information. You've opened the door for conversation. I think that's a big takeaway that I've gotten from you of how important it is to sit with your child in a loving way. Let's have this conversation instead of doing it, on the fly or what have you, but make it important and make it so that they do come to you for questions if they have them.
You don't have to be an expert. You just have to be someone that they can trust and somebody that's open to talking about things that are difficult sometimes.
We can do this. Everyone listening.
We can do this.
We can do hard things. We are parents.
That's what I was just going to say. We can do hard things.
We can do hard things. And that's the joy of the summit. I've learned so much about myself as a parent. I've been taking notes the entire time. I'm seeing my weaknesses. I'm finding ways to build into those weaknesses to bring them into strengths. And
I've been seeing my weaknesses too. I've listened to a couple. I'm like, okay, I have a lot of places I could improve. I listened to the one about electronics, and I need to put my phone down more myself.
Yeah. So it's been really eye-opening. But at the same time, remember that each day is a new day, and you take what you can, you do your best, and you keep on keeping on, Carrie.
Thank you so much for talking to me. I'm really honored to have been here.
You're welcome. Have a great day.
Bye.